Hello, everyone. I'm going to be talking about my advocacy and what I mainly focused on, which is um, my uh, LGBTQIA plus communities, which is basically comparing the needs of my research, needing barriers of survey status, discussing lessons and barriers encountered throughout the advocacy process into discussions outlines social worker community 7, which is focused on assessment as multiple levels. First, based on my research, the main ideas needed, which is LGBTQIA plus communities include access to infering healthcare and mental health services, legal prosecution, safety, safe housing, and protecting from discriminations. Research also shows and affirms of these challenges can be linked to minor stress, historical moralizing, and the inconsistent policies of the state law, federal state. Oh, excuse me. Overall, the literature shows that these issues are symptomatic rather than individual, which I honestly do compare in my findings in my survey data that I found a lot of similarities. Surveys participants strongly agree on needing more mental health services and family with healthcare. Most importantly, which support the research overall, already showed my respondents also share their avoidance in healthcare, social services because they're being feared of judging discrimination against others and themselves. This is just reinforcement of research on mandatory stress and intentional mistrust. However, there are many differences between the research and the survey. While the researchers focus on more of the board policies and symptomatic barriers, the survey highlighted everyday experiences such as feeling unsafe in medical environments, lacking providers, and helping me better understand how larger symptomatic issues directly affect individuals on a daily basis. Throughout the advocacy project, I've learned several most important lessons throughout it. The major lesson was the importance of listening directly to the community rather than relying on research. The survey helped me ensure that advocacy efforts were grounded in real life experiences. I also learned how important intersectionality and transparency when it comes with working with the population increasing of both building and building able to build trust and most importantly being able to participate in multiple things. I also encountered several barriers throughout the process. One barrier was political resistance, par partially particularly around LGBTQIA rights, which are made advocacy ever more challenges and misunderstood, which does affect on our population a lot. Some individuals hesitant engaging even with insurance of confidentiality. Additionally to limited and access populations and participants, most data collection analyzations are more difficult to understand and know. I would say overall, the strength and ability to access individual and communities using multiple sources of individuals can be seen from the data analyzation, evidence, advocacy efforts, and directly towards the social work competency 7. I would say this experience enforced the role of social workers in advocacy assessments promoting an equality of LGBTQA plus communities. Most importantly, um, understanding both symptomatic and factors of lived life experiences. And most importantly, I just focusing on advocacy of LGBTQA plus communities. Thank you for listening.